reading the appalling case of Kelemua Mulat, who was denied life-saving cancer treatment by the Home Office on the basis that her asylum claim did not meet the criteria, sadly came as little to surprise to those of us who work here at Doctors of the World.uk. At .uk, volunteer doctors, nurses, and clinic support workers run a clinic in London for those struggling to access the NHS, as well as a helpline. Every day we see patients who have had their urgent care wrongly refused. Patients who have had their cancer surgery cancelled, their chemotherapy abruptly stopped, their cardiac surgery refused, or, at the end of their life, denied the support and reassurance of palliative care. In October 2017, the NHS charging regulations dramatically changed the way in which the NHS operates. Founded on the principles of being based on clinical need, not ability to pay, the idea of being refused healthcare because of being unable to afford the bill is alien to most of us. Yet, in the UK in 2018, this is what is happening. Those not eligible for NHS care must pay in full upfront or be refused the treatment they need. Two assessments must be made in the new system: firstly, the assessment of urgency of care, and secondly, the assessment of eligibility. As a doctor, it is devastating to see patients with treatable, and often preventable, conditions being refused the healthcare they need. Theresa May refuses to rule the NHS out of trade talks with the US. However, as clinicians, we are not powerless. There is an exception. Urgent or immediately necessary care must never be withheld, regardless of ability to pay, and this assessment of urgency can only be made by a clinician. The Department of Health and Social Care supplies a form that clinicians can use to document their decision clearly in the patient's notes. The assessment of eligibility, that is, whether a patient is entitled to free NHS care, is a separate issue. The guidance is clear: this assessment is done by a non-clinical overseas manager, OVM, and should not interfere with or delay urgent care being given. Despite this, time and time again we hear of OVMs refusing patient care with no clinician involvement. The treatment of Mulat is therefore not only horrifying, but in direct contradiction with the guidance. A clinician had deemed her treatment immediately necessary, but it was still refused. I know that any of my colleagues could be the next doctor who is at the point at which the clinician assessed her care as immediately necessary should have been the point at which her treatment began. Her care may still have been chargeable if she is not eligible for free NHS care, but not upfront, and not refused if she could not pay. The patients we see in .uk clinic are not health tourists. They have on average been in the UK for 6 years, and are young, healthy individuals. They have come fleeing from war and persecution, not for healthcare. Most are destitute, with 87% living in poverty. Withholding treatment from any individual costs more in the long term and threatens the health of the whole population. Evidence is overwhelming that early diagnosis and treatment of disease costs less, with better outcomes. Leaving a condition to the point that it requires emergency treatment costs far more. These regulations prevent individuals from accessing healthcare, and risk not only that person's health, but public health too, as early detection and treatment of infectious diseases and better resource management through preventative care benefits all. Protesters call on the government to reverse cuts to the NHS. Demonstrators dressed as an undertaker and carrying a fake coffin. Demonstrators gather on Gower Street in central London ahead of a march towards Downing Street to protest against underfunding and privatisation of the NHS and demand an end to the winter crisis in the health service. Health workers and NHS campaigners march through London to a rally outside Downing Street. Thousands of protesters marched during the demonstration organised by the People's Assembly Against Austerity campaign group that called for better funding for the National Health Service, NHS, to end the winter crisis in the national healthcare system. A Boris Johnson impersonator lies in a makeshift hospital bed next to an effigy of Theresa May during a People's Assembly demonstration against the Conservative government's health policy. A demonstrator in a mobility scooter carries a placard. Demonstrators take part in an emergency NHS Fix It Now protest demanding an end to the funding crisis in the health service. Demonstrators take part in pro-NHS march and protest towards Downing Street in central London. A protester carries a placard featuring Britain's Health and Social Care Secretary Jeremy Hunt. The demonstration is focused on the current crisis in the National Health Service. Demonstrators hold placards and set off flares. A demonstrator carries a cardboard skeleton wearing an ambulance uniform. Demonstrators hold placards during a People's Assembly demonstration against the Conservative government's health policy. The government will be urged to provide more beds, staff and funds to ease the problems facing the service. Protesters gather calling for an end to the crisis in the NHS. Shadow Health Secretary John Ashworth joins people taking part in the march. A placard reading "Nurses would fight for the NHS." Protesters carry placards and shout slogans. People march through central London. People take part in a march in London in support of the National Health Service. People hold up a sign in support of the National Health Service to demand an end to the crisis in the NHS. Protesters carry placards featuring Britain's Prime Minister Theresa May and Britain's Health and Social Care Secretary Jeremy Hunt. People take part in a march in London in support of the National Health Service. Demonstrators carry placards. Patients are not an immigration status. They are people in need of healthcare. Denying a person the care they need for a treatable condition is immoral, inhumane, and costs the NHS far more in the long run. Mulat's experience shows how confusing, unworkable and devastating the regulations are for patients and healthcare professionals, who are being stopped from doing their job. These regulations must be withdrawn. In the meantime, it is essential doctors know their right and obligation to always provide urgent or immediately necessary care to their patients, whatever the circumstances. Dr. Lucinda Hyam is a health advisor at Doctors of the World UK, part of the Médecins du Monde network.